In Africa, a lot of the public health problems we have very simple solutions that we easily miss. Currently, we have seen the devastating effects of Ebola. We are currently battling with maternal and child mortality rates. Sometimes mothers are not able to get to the health facilities for services, or mothers who may get to the health facilities, but then the quality of care that they receive there is minimal. And we realize that all of these things are things that we can prevent using simple technologies. We want to connect these mothers, we want to connect these facilities, we want to connect these health facilities and then nurses to doctors remotely. During my internship, I realized that technology can address some of these challenges. I had my internship with Microsoft here in Ghana. At Microsoft, one of my roles was to develop a concept paper on how to transfer data from an ultrasound machine onto a computer, and then from the computer where a doctor can have access and help a midwife in a rural community. I worked with GE Healthcare to develop this particular concept. Now, one of the things I realized during my internship was that I needed to develop a technology, think about the programming aspect of the technology and how this technology can be implemented in a rural community, in a rural setting where network access and all of that is difficult. All of these skills were critical skills that I didn't think about. But until I started working on this particular project and until I started going out to the field to understand how I need to get this thing done, I realized that skills that I had learned several years back at the university were very essential here. So I had to go back there and pick those skills. One of these skills has to do with my programming and coding skills, where I had to go and learn again, how do I develop a technology like this? How do I try to make it interoperable so that other platforms can make can make good use of this particular technology. Significantly, there has been a lot of change in my life after this internship. One of the greatest changes that I had to change and rediscover myself and my purpose in life, where I need to go back and pick skills that I had thought were not useful and then apply these skills into my public health practice. These are skills that are very essential. These are skills that are going to help me not only develop in my career, not only develop what I'm doing in my organization, but also skills that will impact lives in the community. I have been able to do all of these things, taking up all my courses again in IT programming and then coding, and have been able to also interact with a lot of people through this internship. I have had the opportunity to identify how partnership should look like for an organization. I've had the opportunity to understand how partners should actually play a role to get a technology like this done. These are very critical changes that has happened in my life following this internship. And that is why I realized that if you have the expertise in public health, you may not necessarily be in a good position to address all of the problems. But if you add more value to your skills and your expertise by developing your technological skills, software development skills, you will be able to actually think through some of the problems that we face, come up with very simple interventions, come up with very simple technological interventions that could address some of these things. And that is why I find my internship at Microsoft very significant. That's why I find my internship at Microsoft very valuable, and it's adding more value to my profession, it's adding more value to whatever I do. Thank you.